I'm Suzanne. I'm from Healthcare for All. How many of you have heard of Healthcare for All? Oh, good. Quite a few, but I'm still just going to give a brief overview just so you know that we're a resource in the community available to you. So we're a state-based organization, so we're based in Boston. We're a statewide consumer health advocacy organization advocating for consumer-friendly health policies in Massachusetts. And we have two main areas of our work. One is we do advocacy through direct service. We have a helpline where we have counselors who speak English, Spanish, and Portuguese, the top 3 languages spoken in Massachusetts. And for those that we don't speak, we have relationships with other community organizations we can refer to. And we help people figure out the very complicated healthcare system in Massachusetts. And we help them get access to healthcare, we help them apply for healthcare, and troubleshoot issues with their healthcare. And we don't have, we're a nonprofit organization, but we don't have any income limits of people who we assist. So anyone at any income level can call our helpline. You just have to be a Massachusetts resident because that's what we know. We know Massachusetts. Every healthcare system in every state is different. And the other piece is that if you're a senior over age 65, we often refer over to Shine counselors who are more well-versed in Medicare, which is a federal program. And the second piece of advocacy that we do is advocacy up at the State House and with state agencies such as our Medicaid agency and Division of Insurance and other agencies like that, following very closely legislation, the state budget, and policies. And I have to say, in my 11 years at Healthcare for All, I have never been as engaged in what's going on the federal level as I have in the past year. And maybe that was a mistake on my part, but it also is just a testament to kind of what's going on now and how much is at risk in healthcare and across all the different programs that we care about. Because most of the programs that, besides health, actually have a big impact on your health. There's more recognition every day that things like housing and transportation and access to healthy food actually, and your environment and other things like that, actually play a bit larger role in your health than medical services do. So all these things are very important, and I think they're all part of one, and as you said, need to be looked at as, from an intersectional viewpoint. So I'm just going to give a couple of, just a step back first about how people get healthcare in Massachusetts, and then talk about a little bit about what's going on the federal level and what the impact is here. So there are 5 main ways that Massachusetts residents typically get health insurance. First, and the most common way, is we still have an employer-based health insurance system, so through employer or through your school. Like, so if you're a student at MIT, you might get it through MIT, and if you work for MIT, you would probably get it through MIT. Second is the federal Medicare program, which is for seniors and people with disabilities. Third is our Mass Health program, which is actually a combination of the Medicaid program for low-income individuals and families and the CHIP program that Josh alluded to earlier. And then the next 2 are basically similar, but you can buy insurance on your own. You may, if you're under a certain income level, be able to get subsidies for your premiums and other costs through buying through the Health Connector. That's our marketplace here in Massachusetts, and it was one of the frameworks for the Affordable Care Act. Or if you're over certain income levels and you don't have an offer of employer-sponsored insurance, you can purchase health insurance on your own, but you have to pay full freight. So it's a very complicated system, a lot of moving pieces. We focus, and my focus at Healthcare for All is mainly on the Mass Health program and subsidized health insurance for low-income individuals and families, but I do have a counterpart of my organization who focuses on private health insurance as well. So those are the 4 main ways. I think what I'm going to focus on is how the federal potential budget changes and other policy changes and the tax bill impact primarily subsidized health insurance and our Mass Health program. So we're very happy that CHIP has finally been funded. To say this has been the longest time it's been unfunded after it needed reauthorization since its inception. So just to give you a kind of a sense of scope, in Massachusetts, about over 1.8 million people are enrolled in our Mass Health program. And as I said, Mass Health is our Medicaid and our CHIP program. So of that 1.8 million, about 172,000 children are enrolled in Mass Health because of CHIP. And those kids really would, We have a good, a really, really good track record in covering kids in Massachusetts. About 99% of kids and 97.5% of adults, or the whole population, are covered. But that would have taken a big hit to the budget, the state budget, $295 million a year we would have lost to the state if CHIP was not refunded. It is really, so we're really thankful that that's moving forward. Typically, we get 50% federal reimbursement for our mass health program as a whole. CHIP, we actually get 88% right now. So the federal investment is huge for the Commonwealth of Massachusetts for kids' health care. And that 88% is actually going to go down to 65% over the years in the deal that they came up with in Congress, but we expected that would be temporary. It was under the Affordable Care Act that states got kind of a bump in federal reimbursement for this program. The other thing I want to talk about is Medicaid, the Medicaid portion of this funding. The fact that the new tax law creates a $1.5 trillion deficit means that those who created that deficit are going to look at that and say, now we need to cut programs that are really important to poor people, including Medicaid. We're already seeing some ways that they're trying to undermine Medicaid. One is there's an announcement that the new CMS administrator wants to have work requirements in order to get Medicaid. Thankfully, we are in a state where the governor has already proclaimed we will not be doing that, but many other states are not in that bucket. So we're really worried what is going to happen down the line, given that now there's going to be some push to have so-called entitlement reform, which would include Medicaid, and what the impact would be on the state. Not only on the state residents who we care about, who rely on the Mass Health Program and on Medicaid, but also on hospitals, community health centers, which are also creators of jobs and also bring back money into the economy. The other piece of the tax law was the repeal of the so-called individual mandate, the requirement that you have to have health insurance if it's affordable to you. I just wanted to remind everyone in this room that as a kind of pioneer in some of health reform in Massachusetts, we actually kept our state individual mandate, so it still is a requirement in Massachusetts to maintain health insurance if it's affordable to you, and there's state rules around that, John. And if anyone's interested in learning more about that, I'm happy to talk about it offline, but wanted to keep it relatively high level. The other thing we're looking at in the budget is the lack of funding for community health centers. That funding still has not been reauthorized. That would be a $196 million hit to community health centers in Massachusetts. Boston was actually where one of the first community health centers was created, and we have a great community health center system in the state. It would impact about 141,000 residents who seek primary care and other important services at community health centers all across the state. We have 50 plus community health centers in Massachusetts, and they're really a key to serving lower income families, even serving people who are uninsured. We still do have a small uninsured population in the state. The other thing that has been mentioned is around DACA and the importance of reauthorizing DACA. The other immigration status that we're looking at is the temporary protected status, and that being phased out for certain populations. And that actually does have an impact on eligibility for health care in the state, and so we're watching that very closely as well. So those are kind of the main issues that we're looking at relative to the budget and to the tax law. We know that there are other attacks that are going to happen to the Affordable Care Act, and we get a significant amount of money, federal investment from the Affordable Care Act to subsidize health coverage for lower income folks in the Commonwealth. And we also know there are other policy options that the Trump administration is looking at to take some healthier people out of the health insurance market and will end up driving up premiums for everyone in the end. So there are also policy and budget and a lot of different things that are happening and swirling around, and we know that, like with everything else that we're talking about today, the fight is not over, and we need to continue to be vigilant and watch what's happening and stick together. So thank you very much.